Hello and welcome to our COVID-19 media briefing. I'm Carrie Schutte. I'm the Public Information Officer for the Shasta County Health and Human Services Agency.
As of Monday, August 23rd, we have had 14,766 total cases, including 175 from Monday. We've had a total of 252 Shasta County residents who have died from COVID, including one that was reported yesterday, who was a man in his 80s. We have had 5 deaths reported in the last 7 days. We have 91 people in the hospital today, including 23 in the intensive care unit. This is another record, the third record we have set in the past week, and so this is an indication that our hospital system is very, very busy right now.
With us today, we have Robin Schurig. She's the director of the Shasta County Public Health Branch of the Health and Human Services Agency. Dr. Karen Ramstrom is our health officer. Judy Flores is our Shasta County Superintendent of Schools. Dean Germano is the CEO of the Shasta Community Health Center, and Mark Mitchelson is here representing Shasta Regional Medical Center. Thank you all of you for being here. And as always, we'll start with an update from Robin Schurig.
Thank you, Carrie. Good morning, everyone. I will share a little more on the latest data, starting with cases. Again, I'll share the average daily case rate and the way that we and the state have been tracking it, and I'll also share the CDC's 7-day case rate. The latest data, which was released yesterday and is from August 16th through the 22nd, shows that our case rate and the way that we and the state have been measuring it all along is 33.6 daily cases per 100,000 population. This again is very high and has increased very rapidly. And as I mentioned last week, is being driven by the Delta variant, which is much more highly contagious than previous strains of COVID, as well as by the low vaccination rate in our county. Most recent rate from the CDC is 407.6 cases per 100,000 population. And again, that's for a 7-day period and based on when the cases were reported to us, as opposed to when the person's symptoms started or when they got tested. The CDC considers anything above 100 cases per 100,000 population to be high transmission, and our rate is currently more than 4 times that. On to hospitalizations, as of yesterday, our latest average number of COVID patients in the hospital per day over the last 7 days was 74. And as of yesterday, as Carrie mentioned, there were 91 in the hospital, including 23 in the ICU, and these are both new highs. Again, this is due to the Delta variant being so much more contagious that it's able to reach more people, including some who are going to get very sick. And it's also related to the low rate of vaccination in our county. As we've reported previously, the vast majority of our cases, hospitalizations, and deaths have been in people who are unvaccinated, with the numbers from the last 3 months showing 156 cases in vaccinated people compared to 1,621 in unvaccinated people, 6 COVID hospitalizations among vaccinated people compared to 96 among unvaccinated people, and 1 COVID death in a vaccinated person compared to 17 in unvaccinated people. We share this data to convey the effectiveness of vaccination against infection, but especially against severe illness and death. Our latest data on vaccination shows that 43.7% of eligible Shasta County residents, so those aged 12 and older, are fully vaccinated, with another 9.6% partially vaccinated, for a total of 53.3% who've had at least 1 dose of vaccine. This is still very low compared to the state as a whole, as well as the nation. Vaccine remains the most effective way for us to protect ourselves and our families, including those under 12 who aren't yet eligible for vaccine, from COVID and from severe illness or death from COVID. And the Pfizer vaccine just received full federal approval for people aged 16 and older. It still has emergency use authorization for those aged 12 to 15 while data continues to be collected. So if you are 16 or older and you've been waiting for full approval as assurance of the safety and efficacy of this vaccine, you now have that assurance, and we encourage you to get vaccinated. In addition, whether you're vaccinated or not, it's still a good idea to layer on other forms of protection, such as masking, avoiding crowds, especially indoors, and staying home if you're sick, except to get tested. Masking is required for everyone, regardless of vaccination status in certain settings, on public transit, in healthcare settings, in adult and senior care facilities, indoors in K-12 schools, childcare, and other youth settings, in state and local correctional facilities and detention centers, and in homeless shelters, emergency shelters, and cooling centers. For those who are unvaccinated, masking is also required in public indoor settings and at work unless you're alone in a room or vehicle per OSHA standards. And even for fully vaccinated people, masking is recommended in these settings. Those are my updates, and I will turn it over to Dr. Ramstrom.
Good morning, everybody. So as Robin said, yesterday the FDA granted full approval for the Pfizer-BioNTech COVID-19 vaccine. It's going to be marketed under the trade name Comirnaty, so you might hear that language as well. As Robin shared, we really hope that for people who have been waiting for full FDA approval, consider getting vaccinated now. You know, these numbers in our hospitals and these case numbers in our community are very concerning. I mean, that's over 90 individuals and their families who are impacted right now, not to mention the many healthcare workers that are taking care of them. And so we really encourage the community to take advantage of this full FDA approval and go ahead and get vaccinated. I did want to give a little bit of information today on our schools. We're about a week into the new school year, and our schools and public health staff are very busy managing a fair number of cases among students and school staff. This isn't surprising given our very high levels of disease transmission. As I said last week, having our children in school is a high priority, both for their education and overall well-being, as is their health and safety is a priority as well. And to reach these goals, we really need the community's help. Our schools are only as safe as the environments in which the students and staff live, particularly in this high transmission environment. So what does this mean? It's more important than ever that all family members, friends, and close acquaintances of students or school staff fully embrace the prevention measures that we know make a difference. You know, that means vaccination of all eligible household members, staying home if you're sick, not going to school if you've been diagnosed with COVID, or if you're a close contact, get tested, mask use, and avoiding crowds and mixing. This basically applies to all of us because I think all of us touch in some way students and people who work in our school settings. So please help us to keep our school environments COVID-free. That's all I have today. Please be mindful that our disease transmission numbers are very high. So practice these prevention measures and be safe.
All right, thank you, Dr. Ramstrom. Let's go over next to my lineup is Mark Mitchelson from Shasta Regional Medical Center. Do you have an update for us today?
Sure. Good morning, guys. Really, between last week and this week, you know, it's continued to be very, very busy. A lot of sick individuals in our hospitals, and you know, one of the things that we're just trying to do to prevent any transmission is visitors are still being screened at the front door and making sure that everybody's very safe. The good thing is that we're still doing elective procedures. We have plenty of PPE, and we do have an ability to continue to surge with staffing just in case this surge continues to get worse and worse. But we're here. We have the supplies. We have the ability to meet the community's needs. Just, you know, hoping that the surge stops.
We second that motion. Thank you, Mark. We appreciate you being here. All right, Dean from Shasta Community Health Center.
Good morning, all. We have definitely seen an uptick in the number of people coming in and getting tested amongst our patients or having symptoms that need testing. We're going to, in fact, reestablish our respiratory assessment center probably later this week or next. We had closed it down after the last surge, and we are going to reopen it again just for safety reasons. We're seeing a lot more parents calling in and asking for clearances for their kids to go back to the classroom. So we have to make sure that their symptoms are not indicative of COVID. So there's a lot of extra paperwork and other you know, related issues there. We've seen some breakthrough COVID uptake even amongst our staff. So we're having to reestablish the most stringent, you know, limits on masking, and we've had that all along. But I think people start to, you know, get a little lazy, and you have to remind them again that this is not over. And we certainly are encouraging our own staff. We have about 70% of our staff who are vaccinated. We're doing our best to convince the other 30%, those who are not in an exemption sort of status, that this is important. So we do have the state mandate coming, the second one, at the end of September. So we're working on that process. So we're doing all we can. It is stressing our staff and stretching us. And of course, as we lose staff, ourselves to COVID in their household. They're away then for 14 days in many cases. So that leaves a big hole in your operation when you're already stressed. So we too are very supportive. I make one other observation. I went to a local pharmacy the other day to pick up a prescription, and somebody asked if they had any home testing kits available, and the clerk said there was a run on them today and that maybe Walgreens has more. And I heard from another person that they had run out as well. So there seems to be a recognition that this is becoming widespread. I just hope that recognition turns into more people getting vaccinated, because I've said all along, as we've said all along, I don't think we can test our way out of this thing. Really, vaccinations is the pathway to get us out of this thing. In the meantime, we'll have to survive this next cycle of infection.
All right, thank you, Dean. And Judy Flores, do you have anything you'd like to update us with today?
Yes, thank you, Carrie. So as of today, all 25 of our school districts and all 16 charter schools are back in session, and I'm concerned. With the numbers spiking in our community, we've also seen cases within school staff, and schools are challenged to try and cover these positions without having enough substitutes. Schools are doing all they can to keep open. Liaisons who are working with schools, with staff and students who are testing positive, need our patience as they sort through all the information about close contacts to determine next steps. And in talking last night with Shasta County Public Health School Unit, they are also overwhelmed with the number of requests coming in from schools asking for assistance, and they're not able to do the case investigation because the cases are coming in so fast. As was shared earlier, cases are rising among the 12 and under population. In the past 30 days, 134 children under the age of 12 have tested positive for COVID-19. For comparison, for the 30 days prior to that, only 13 people under the age of 12 had tested positive. Over this past weekend alone, there were over 50 requests for assistance that came into Shasta County Public Health School Unit. We have over 1,000 staff and students combined that are on modified quarantine. Shasta County Public Health is working with us to finalize what will move a classroom or school to closure in order to prevent transmission at school. And if a school or classroom needs to close for a period of time, this year, independent study is the only option. So COVID is affecting our schools tremendously, and as Dr. Ramstrom shared earlier, we need everyone's help with vaccinating, keeping kids home who are sick and getting them tested, notifying the school if a child is sick or tests positive for COVID, having students wear masks both on school buses and while indoors at schools, and washing hands regularly. In an updated letter that was sent yesterday from the state public health officer, the requirements for masking was reinforced as both a legal duty and a safety issue in both public and private schools. One of the quotes from the letter is, "The risk to students and staff of not implementing universal masking is not hypothetical. There are well-documented instances where unmasked students spread COVID-19 within classrooms, resulting in outbreaks and high case rates on staff." The letter also states that failure to follow the mandatory public health directive will expose schools and school leaders personally to substantial legal and financial risks, some of which were detailed in the letter. In following the state public health officer's order from August 11th, all school and district staff must either show proof of full vaccination or participate in weekly testing. School and district administrators are working right now to get ready and have their system set up prior to the October 15th deadline. In addition, all staff must wear face coverings regardless of vaccine status when students are present. So those are the updates I had, Carrie, for this morning.
Great, thank you, Judy, and thank you for joining us. It's great to have your perspective on what's going on with our schools and our kids and our teachers and staff. We are ready for media questions.
Well, I've got one for Dr. Ramstrom, I think. Given this spike in cases, in hospitalizations, are you anticipating tighter restrictions that coming from the state?
Yeah, we haven't heard that. I think through these recent health officer orders, they're trying to implement what we know based on the evidence, the mask use and vaccination. Last year, we didn't have vaccination as a tool, right? And so now we do. And so I haven't heard of any additional restrictions coming in. In fact, that question's been asked of them, and there's been no indication that other than what's already in place, coming out anytime soon that I've heard of.
Hi everyone, Anna here from 1224. With the Pfizer getting its FDA approval, one of the first vaccines to get that, we mentioned we've had vaccine hesitancy here in our county. Do you think this will help, reduce that hesitancy within our community? Yeah, sorry.
We hope so. The surveys, some people have commented that that they are waiting for FDA approval. And so we're hopeful that more people will be more confident now. FDA reviewed a lot of data, a record amount of data, in addition to what was reviewed for the EUA authorization for the vaccine. And so we hope people will look at that and reconsider and get vaccinated as soon as possible.
I also had another question too, because I know Dean mentioned he's seeing an increase in testing, and a lot of our testing sites either got condensed into one or turned into a vaccination site. Can we see more testing sites in our community coming back, like those state sites we had in the beginning of the pandemic?
So I think in addition to the state site, the one site that is remaining in our community, there are a lot of providers who are testing now who weren't able to previously. So there are a lot of places to get tested, and there's information about that on Shasta Ready. But we are monitoring how much that state testing site is being used, and we do have the option of requesting either additional lanes at that site or potentially additional locations. But it's up to the state how many resources they have to allocate.
I would just add that we've had some challenges getting testing supplies again. Again, the demand and supply cycle. We have managed to do that. I think others have, but it's quite interesting. It's gotten, allocations have been more restricted. So we've been challenged a little bit by that.
I did have another question. Butte County announced yesterday they would be offering boosters for the vaccine. Can we see Shasta offering boosters for any of our vaccines anytime soon?
The boosters for the general public are not yet available. They haven't gone through the regulatory process with the FDA. And so I think what Butte is talking about is the ability to, for people who are immunocompromised to get an additional dose of vaccine. So once they've gone through the 2-dose series, to get an additional dose of an mRNA vaccine.
Okay, thanks, Dr. Ramstrom. I just want to clarify, thanks for clarifying that. But for that group, will that be a, for our immunocompromised group here in Shasta, will we be seeing that too for them?
Yes, people are already getting vaccinated as of last week. So that's been in place and accessible.
I also wanted to add with the testing, we're updating our testing webpage. There's a link on our website to the state site that shows testing, but we're also double checking all that information. And we know that Rite Aid and Walgreens do testing at their locations through the drive-through appointment only through their websites. So that might be convenient for some folks. Are there other media questions?
I have a series of questions. If anyone wants to jump in at any time, please feel free to interrupt me if you have anything else too. But this one is just kind of like going to Judy Forey's regarding schools. Do we know at this time within the Shasta County school community how many school staff have been infected as well as students?
Well, so the latest numbers, we get our numbers from Public Health on Wednesdays. And so as Carrie mentioned earlier, we don't yet have that data. So the data that we had was what I shared last Wednesday. And so, but anecdotally from a few superintendents, the numbers are extremely up from where they were a week ago.
And then just to follow up on that, you mentioned, schools are asking for more resources. Are they kind of with, COVID cases, are they kind of just asking for more of those COVID liaisons, basically, because we're seeing an increase in cases?
Actually, the largest need is as we think about substitutes across any area within a school. So whether that's working in the cafeteria, whether that's a bus driver, whether that's an instructional assistant, paraprofessional, or teachers, having substitutes for any of those positions. Because when a teacher or a school staff needs to go out, those positions still have to be met. I talked with a superintendent this morning who was actually in a class teaching yesterday because they had no substitutes. And so it's a huge issue already, and we're only a week into the school year.
And then, thank you, Superintendent. You also mentioned modified quarantine, and then you're also working in collaboration with public health. Can you explain the modified quarantine as well as working on that school plan? Does that mean that plan that you're working on with public health, does that mean like a possible school closure plan?
So I'll start with modified quarantine. So modified quarantine, if the students have been wearing masks and their tests, then and they're exposed, what they need to then do is and have no symptoms. Let me add that. Then what they do is need to be tested twice a week. And if they continue to show a negative on the test for quarantine for COVID, they're able to stay in the classroom. They still need to wear their masks, but they're able to keep coming to school. And that was one of the state's big concerns this year, was to increase the amount of time students were in school. But in one of our districts alone, between the staff and students combined, they have 1,000 people on this modified quarantine, which is about a fifth of their population. And so when you think about what's needed by way of staffing to be able to do that kind of twice a week testing, it's becoming unreasonable, right? Just the staffing alone of that is not, they're not able to keep up. And so with that, we're having conversations with Dr. Ramstrom, with Robin Schurig, as well as those within the school unit at Public Health, along with several of our larger school district superintendents, to talk about what will it look like? When will we need to close a classroom? When will we need to close an entire school, simply to get a handle on the transmission that's taking place?
Thank you. And then, like I said, I just have a series of questions. So if anyone from other media members would like to jump in, please feel free to. It was mentioned yesterday in the update, we're seeing kids under 12 going to ICU. We're seeing a lot of kids under 12 getting COVID, but are they also, this one's for the hospitals, are we seeing like under 12 kids also going to the ICU? Like what's the age groups we're seeing now in the ICU? Back then it was like 70s, 80s, like 60s. How's that looking like in this day or this time, the COVID pandemic?
And to be honest, I would have to defer that answer to Mercy when they get back on for next week. Of course, they're being the pediatric hospital of the county. We are seeing a fair amount of individuals, in their 50s, young 50s, and older at Shasta. But yeah, it's been a combination of the two. But pediatric related would be all through Mercy.
Thank you, Mark. And then one more thing for that, in the beginning of the pandemic, I'll just ask for you because Mercy isn't on this call today. Could we possibly see for Shasta Regional, see a no visitor policy again with these surge in cases? I know you said you were screening visitors, but will that be a thing? Will that rule come back?
I wouldn't say it never will be. I mean, if we continue to see a surge, that might be an option that we decide to do. What we've really tried to do is keep visitors in the hospital safely, just because we know that it's one of the best things for healing of our patients, both emotionally and physically. And it's great for your family as well. So, I mean, yes, potentially, but it's not ideal. Worst comes to worst, we may have to do that at some point.
Thank you. And I think that kind of just covers it for me, if anyone else wants to jump in.
Could I ask, I'd like to ask Judy a question. Is it fair to call the situation in the schools a crisis at this point? And can we infer that a lot of staff members are not vaccinated because of what's going on?
Well, so Mike, the only way we can talk about the number of vaccinated staff on a wide scale is if we go back to when we did the vaccine clinics in the spring. Because beyond that, I don't have access to any of those numbers. I know districts are now creating systems to gather vaccination status, but last spring we saw about 50% of school staff go through and get the vaccine. So we know that since those took place in late February, early March, there's been much more accessibility and ease of accessing the vaccine. And so I really don't know what those numbers look like currently. We'll have a better sense after October 15th when all of that information needs to be gathered. But right now, I don't have a strong sense of that. I would say that in terms of this idea of crisis, it varies, right? We have our latest school district in the county, Fall River Joint Unified, just starts today. Today's their first day of school. We had 2 other districts that started on Friday of last week. So it's not an even spread across our school districts. We certainly are seeing a more significant impact in a few of our districts right now, but they are the ones who started earlier in the week last week. So we know more, and we'll have to wait and see as the week progresses the impact for those who started, say, Wednesday through Friday of last week.
Thank you.
Any other media questions?
Sorry, I just wanted to double check one thing, and I'm sorry if I missed this. For the hospitalization and ICU numbers that were given today, the 91 and 23, do we know how many of those were vaccinated versus unvaccinated?
We do not. It does take a little bit of time for our epidemiology team to cross-check the various records that we have. But you can see that on our website, and this chart will be updated again tomorrow, but in the past 3 months of doing the math in my head, of the 102 people who have been hospitalized, 6 of them have been fully vaccinated. So it's, 90+% of people are unvaccinated at this time. And I don't think we have reason to believe that that number is significantly different today.
Thank you.
Any other questions?
I realize this requires a little speculation, but how close do you think we are to having to open additional, for instance, a site where we could deal with the increasing number of hospitalizations, ICU capacity? Are we getting past capacity? How close are we to needing to create sort of a tent hospital or some kind of facility where we can care for any overflow?
I can take that one. So really, I think the strategy that we did last time worked real well for us, in the sense that the tent hospitals, and you saw them nationwide, really weren't as effective as utilized as they probably could have been. Here in Shasta County, we definitely have still a fair amount of ability to surge into more ICU beds, more medical beds within our actual structure. So as long as we have the supplies, resources, and manpower to take care of that, which I believe we do, we're not close to needing to request any sort of tent city hospital thing. We'd rather take care of it within the walls that we have currently.
I would just add that if you go to the northeast of us into Klamath, Medford area, they are requesting a field hospital now because they are at capacity up there, beyond capacity. And whether that's a bellwether, we have a lot of capacity here locally, and thankfully that's true. But I don't think you have to look very far to see what happens in communities of low vaccination if this thing gets really out of hand. So, you know, look it up. I think you'll find that it's become a real problem in some of our neighboring areas.
All right, any other questions from our media? Okay, thank you everyone for being with us. We're just 2 minutes over, not too bad. We will have another briefing next week with time and date to be announced, so stay tuned. And thank you all. Please stay safe and healthy.
Thank
Thank
you.
you.
Thank you.